So we are at a point in the program where we're going to have some Q&A, but I feel like, given that it's almost 10:15 and we're trying to get into our breakout sessions at 10:30, we might have more constructive dialogue with the panelists in those smaller settings. And I wanted to make sure we have ample time for our three respondents, which we're going to give each of you about 5 minutes. Is that okay? And I'll be, or less. But let's, if you take less time, we'll have maybe a little bit more for Q&A. But let's kick it off in the order that you're in. And I'm just going to give you a 1 minute warning. But we'll have our first respondent to the panel this morning, Mark Erlich. Mark, please introduce yourself.
Okay.
As the Executive Secretary Treasurer of
Wait a minute. My name is Mark Erlich. I'm the head of the New England Regional Council of Carpenters, and I'm also the chairman of our benefit funds, which obviously include health insurance. I think from the perspective of the Taft-Hartley building and construction trades organizations, the context that we have when we evaluate the ACA is not that our members are now getting coverage that we didn't in the past because we have provided, if you work in the industry, you've got coverage. So the real issue in some ways that we were hoping to see, apart from a larger social good of universal health care, which I obviously support, was that the bill would address cost containment. That our costs for, it varies from trade to trade, but basically everybody's costs have pretty much tripled over the last decade. And the consequences are twofold. One is that every collective bargaining increase that you get, the bulk of it goes to keep the health insurance program alive. And the other is it increases the lack of competitiveness between union and non-union contractors, because the non-union contractors increasingly, at least in my field, some of them used to provide health insurance 10, 15, 20 years ago when it was relatively cheap, and now very few of them even offer that at all. So it just it increases the delta between the bids that are offered by union and non-union contractors. In terms of and the other part about the issue of competitiveness, the employer mandate model, and as Karen talked about, the 50 or less, since most construction employers are small contractors under 50. It exacerbates that competitiveness level, because you got the larger contractors who are union, who are obligated under the mandate, and you've got smaller contractors who are non-union who then escape it, and if they happen to be over the 50 threshold, they can also do what has happened in construction for 20 years, which is you take an employee and you call him or her an independent contractor, and thereby avoid, it's illegal, it's unethical, it's unlawful, but it also allows you to avoid hitting that threshold. So that's sort of the context that when the ACA arrived on our doorstep. I think the best way of describing the ACA is it's a series of compromises. And one can argue that politically those are necessary. I'm not here to have that discussion today. But I think you had, on the one hand, you had compromises between those who were supportive of the notion of health care for all, which I think probably everybody here in this room is, versus those who weren't. You had the problem in terms of creating the conflict between universal coverage versus cost containment, and then you have the issue about the sort of a public option, publicly funded system versus one led by private insurers, and we obviously know who won in that particular conflict. And I think as a result, that while I certainly welcome the notion of 8 million people being covered who weren't, it's a wonderful thing, great step forward for our society. The issue of cost containment just went out that, they won. The insurers won. In the fight for the compromises. In order, as I think John described, it was a calculated political decision in order to buy their support. They won, and they got everything they needed. And the issue of cost containment is out the window. And as all the speakers have said, whether it's 3% or 5%, if anything, it's not only is there not cost containment for our funds, there is cost increases, which seems a little odd when everybody in the world is talking about cost containment. I guess I would just raise one point, which is there appears to be a particular hostility toward Taft-Hartley funds that has evolved over time. And you got to say, well, why is that? That seems a little bit odd. Certainly, Obama's quote about everybody could have the coverage they had, blah, 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 has been thrown in everybody's face repeatedly. And I'll tell you why I think there is such hostility to Taft-Hartley funds. We have a system that works, and it doesn't fit into the model that the Obama administration is trying to accomplish through the exchanges. We just don't fit. Right, wrong, or different, we don't fit. when they lost the battle for the public option to the private insurers, I think some of the people, this is my guess, and I'm sure the people here on the panel know better than I do, but my feeling is that the people within the administration supported the idea of public option, because I think most of us know that certainly if you're going to tackle cost containment, you have to do it through a public option, Medicare for all, single payer, whatever you want to call it. That's the only way to really get to cost savings. Then you need to, that's the model you need to use. The Taft-Hartley represents an alternate model, and so I think they've used the notion of the exchanges as a way of driving people into exchanges as a way of accomplishing the public option without actually saying it and being accused of being socialist or whatever. So I think that's why, I think, not that labor has gotten such a great deal out of the Obama administration anyway, but I think a lot of folks in our organization wondered why they've been so rigid. As John said, everybody else has gotten compromise. How come we haven't? And I think that's because they want to drive the Taft-Hartley world into the exchanges. So I think that's an important political point to understand about why it's been such a problem. Final point I would make is we have actually stolen from the Unite here. I applaud what they've done in Atlantic City and Las Vegas. We have actually working with the same group of people to do a Carpenter care program, a primary care program that we think will help deliver better care. It's a really exciting initial program. It is more complicated than the hotel workers group because you've got a fixed body of workers in a single site or a strip or whatever, and our folks are all over God's creation. But we're doing it, and it's growing, and it's working. But I will tell you this, I'll close on this. It's ridiculous that we have to solve that problem. It's ridiculous that the Unite here, which is I applaud for what they've done, has to solve that problem. It's ridiculous that the Carpenters or any other group has to solve that problem. For Christ's sakes, that's why we have a government. I'll end there.
It does give me great pleasure.